Good morning. It's so great to see so many people here. I'm going to introduce Dr. Henry Perry to us. I'm going to read all of this because I think it's super impressive. So Dr. Perry is a physician with graduate training in sociology and anthropology who has 3 decades of experience in the management and evaluation of health programs in developing countries. He is the founder of NGO Cure Global, now working in Bolivia, Guatemala, Haiti, and Liberia. He has lived and worked in Bolivia, Bangladesh, and Haiti, and he has provided on-the-ground assistance to programs in 15 countries around the world. He is the author or co-author of over 100 publications about primary health care, health manpower, and community-based approaches to health improvement. He has a broad interest in primary health care and community-oriented public health, community participation and equity and empowerment. Dr. Perry has received the Gordon Wyan Award from the American Public Health Association for Excellence in Community-Oriented Public Health and the Doris Storms Child Survival Recognition Award from the NGO community for exceptional efforts resulting in more effective child survival program implementation and increased impact in improving the health of the poorest of the poor, including mothers, children, and infants in underserved communities throughout the world. Impressive. So today he is coming to teach us about a personal journey of bridging faith and learning in global health. And as soon as they finish talking, it's all you.
Okay.
You want this?
Yeah, well,
You go.
I guess I don't need to do it. Okay. Good morning, everybody. It's great to be back again. And for some of you, you're hearing this a second time, and I apologize for that. But for those of you who weren't here last week, we had a major technical glitch because the fire alarm went off in this building. They couldn't shut it off. And so we made a retreat into the basement of Duke Chapel where we didn't have the audio internet connection, and I gave my presentation, but I'm giving the same presentation again now. So some of you weren't here last week, so that's great. We're continuing to have technical issues, and all this works fine at home on my computer, but when we link into this system here, all of a sudden things get really screwed up. So I apologize for that. But maybe I'm going to have Bodie run my slides until he gets that little better shape. But I entitled my talk, A Journey of Faith and Learning. And bridging faith and learning is the motto of the Duke Chapel. And as you'll hear me say as I go through this, there are all kinds of linkages in my life story that go back to Duke and Duke Chapel. So I am very happy to share that with you today. So next slide, Bodie. So I entered this world in a very special way. That photograph there is me on the right, of course, and then my father to my left, and then my grandfather to his left. And my name is Henry Baker Perry III. My father and my grandfather were both physicians, and I was born in Boone, North Carolina. And my father and my grandfather attended my delivery, and my name is Henry Baker Perry III. So this is like a beginning point for me because I was born into a medical family. Next slide. So I've got this divided into 3 parts of my life's journey. So the first part is up until I completed my work with Andine Rural Healthcare in 1994. And you can see there that I have gone through a whole series of things here, and not gonna read all this, but I did come to Duke as an undergraduate, and I came to medical school here for 2 years, and then I had the great privilege of going to Johns Hopkins in Baltimore. I trained in general surgery, and then I got involved with work in Bolivia, which I'll share a little bit more about next. So go ahead, Bodie. When I was 12, my family was attending a brand new Methodist church in Greensboro, North Carolina, called Christ United Methodist Church. and we met at a schoolhouse. And when I was 12, we were at a Maundy Thursday service and remembering Jesus' sacrifice being prepared to be crucified. And we sang this hymn, "When I Survey the Wondrous Cross," which all of us know. But when we got to the very last stanza of that, it says, "Love so amazing, so divine, demands my soul, my life, my all." That hit me just like a whirlwind. And I was thinking about Jesus' sacrifice for our sins. What can I do with my life to repay him in some small way? And so the idea came into my mind that maybe I could try spending my life serving other people in other countries who didn't have medical care. So that was a call to be a medical missionary. I didn't go around telling people about it. It was something that was kind of buried in my heart. But as time went by, various things happened that encouraged me on that path. And one of the important things that happened was, go to the next slide. One of the next things that happened was about that same time, I was able to meet a man named Ernest Sundrum. Ernest Sundrum, at that point in my life and his life, was completing a year of surgical training at Duke Medical Center. And his father was the bishop of the Methodist Church in India. He was planning to go back to India to work in a Methodist hospital. And my church was looking for a missionary to support, and they connected with Ernest Sundrum, and he came to our church many times during that year, and my family became good friends of his, and I got to know him. And he was the only person I'd ever met at that point who was from another country. So it was a very special thing for me to be able to connect with Ernest Sundrum, and he became my lifelong friend. And we have managed to stay in touch over all these years until he died 2 years ago. And in fact, his wife Sheila is joining in with us. Sheila, can you say hello? Just wave your hand. Yeah. So we're still friends and stay connected, which is wonderful. Anyway, he spent his life providing medical care in India, not only in surgery, but he drifted into community health and primary health care just like I did. So here we are playing. We love to play tennis. When I lived in Bangladesh, I could visit them from time to time, and we love to play tennis. And here he is visiting with my mother and his wife, Sheila. Next slide. So when I was in my first year of medical school, Duke Chapel decided to have a work team of students to go from Duke down to Bolivia, South America. And that was through a friendship between the dean of the chapel at that time, Howard Wilkinson, and a missionary in Bolivia. And so I joined in with that group. And we spent the summer vaccinating children against measles up on the northern Altiplano of Bolivia, which I'll tell you more a little bit after that. The other important thing that happened was the Duke Medical School curriculum was such that the third year had become a research year. And I wasn't interested in research, and the medical school enabled me to go to spend the year studying public health instead of doing biomedical research. So I was able to go to Johns Hopkins and had a wonderful experience up there. Oh, are you running it over there? Oh, okay.
Next.
Yeah, next slide. I had a wonderful experience there. I was able to get further graduate training in sociology and anthropology, public health. I finished medical school. I went into general surgical training because I thought I would be working in an isolated place in a developing country, and I felt that I needed to know how to do surgery if I were going to do that. But at the same time, I've found this monograph. I read this monograph. It's published in 1980. And the title of it is, "Can Health and Nutrition Interventions Make a Difference?" And it was a review of the world's experience with programs that had tried to reduce under 5 mortality of children and demonstrate whether they had actually done it or not. Sounds like a pretty simple thing, but there were only 10 examples in the world at that time that had done that. And so I also at the same time had about that time had had the great opportunity of visiting a program in Haiti called the Hospital Albert Schweitzer. Go to the next one. We'll back up. Sorry. And then I came across these people I'll tell you more about in a minute, named Gretchen Berggren and John Y. and Warren Berggren. But I got this bee in my bonnet that I wanted to be a part of a program that demonstrated that we had actually improved mortality of children, which was a pioneering thing at that time. It sounds pretty simple, but it wasn't. Anyway, I finished training in general surgery and I thought that I would spend my life as a medical missionary, but bureaucratic politics got in the way and that didn't work out. And so go to the next slide. So I had the great privilege of having a connection to William Anlian, who was the Chancellor for Health Affairs at that time at Duke. And this was in 1980. And Duke didn't have any global health work at that time. And so I asked him if Duke would consider sponsoring this work that I wanted to do in Bolivia. And he said, after extensive discussions and submission of a formal proposal, et cetera, he said Duke would sponsor this under two conditions. The first condition was that Duke had none of its own money to put into it. And the second condition was that Henry Perry would be raising the money for it. So that's how I started out. And we were put in the Department of Community and Family Medicine at Duke, and Dr. Harvey Estes was the chair of the department at that time. And I don't think he's on here, but I'm still in touch with him. He lives at Crowsdale. And I invited him to join, but I don't know whether I can't tell from here whether he joined or not. But anyway, I spent 3 years from 1981 to 1984 as a faculty member at Duke, but living and working in Bolivia to start a health project. Next slide. So this got a little screwed up, sorry about that. But we worked on the northern Altiplano of Bolivia, 13,000 feet high. And I used to like to tell people that I was the highest paid surgeon in the world. But if you can turn that video on, Bodie, and go to 348. I've got 3 minutes of this video to give you a sense of what we were doing at that time. This is what we were having trouble with earlier, so it may not work, but I don't know why these technical glitches arise, because most of the time things seem to work fine. But anyway, we don't have to show that, but it's a video of the place we were working, very rural area where Aymara, indigenous American people called Aymara, were living, and almost no medical care at all. And it was in an area where the Methodist Church had started work 20 or 30 years earlier. They had a small hospital, and they also had a small school and a church. And so that was the center of our work, but we were planning something that was going to be much bigger than that. But it was a community health program
physician, surgeon,
in which we were reaching out to every household through home visits, and we were registering vital events, and we were able to show that we had reduced the under 5 mortality in this small population where we were working that grew to 40,000 people. We reduced under 5 mortality by half. And so that was a lot of work to show that. And we were very proud of what we did. So I guess just go on to the next slide, Bodie.
technology Each year, almost 7 million
Go
children.
to 3:48, 3 minutes and 48 seconds.
In the high mountains of Bolivia, in the most remote villages, healthcare as we know it is almost non-existent. Early in his career, Dr. Henry Perry lived and worked alongside the indigenous people, providing healthcare services.
I wanted to be a medical missionary. That was my original calling, and I wanted to be out there helping and feeling the pain that people had and being with them and addressing their medical problems.
He's always wanted to reach people who are very vulnerable, and we often find there's vulnerable populations in areas that are hard to reach, that are sometimes very dispersed.
Every day you came across people who had enormous medical problems that you knew could be prevented or could be treated if the proper program were set up that didn't require expensive or sophisticated medical services.
He realized that just the skills that he had, even as a surgeon, weren't enough to reach the number of people who needed medical care. So that kind of inspired him to start an organization and train community health workers and address the problem more from a public health perspective.
Dr. Perry devised a delivery plan centered on using local community health workers, neighbors really, who would routinely visit and teach basic healthcare practices.
Henry is seeing the fact that the majority of healthcare delivery takes place in the household. Many behaviors could be practiced in the home that would save children's lives if only people had that knowledge and that sort of data and understanding of what to do.
By developing close relationships with the people, healthcare workers can create programs that meet local health needs. After several years, the community noticed dramatic changes because of Dr. Perry's project.
Yes, I remember before the project came, many children died, especially the very young ones. The project has helped our community very much.
Through Dr. Perry's NGO, Cure Americas Global, his methodology was implemented in Guatemala, India, and Africa, and all proved to have the same powerful impact.
So after we lived in Bolivia for 3 years, we had to leave because of political problems in the country. The whole thing fell apart. I relocated to Lake Junaluska, North Carolina, and started a surgical practice. I trained in general surgery, as I told you. And so I thought that the work that we had started in Bolivia had ended. I began a new stage of life. And over the next few months, from the time that I started my practice in Haywood County, west of Asheville, the work and the forces that had led our work in Bolivia to disintegrate suddenly changed 180 degrees, and the people wanted us to continue it. And so I said, well, I'm going into surgical practice in Haywood County. I'm not coming back to Bolivia, but I'll try to help as best I can. And so for 10 years, I practiced general surgery, and then I helped the continuation of the work that we started in Bolivia. It became an NGO called Andean Rural Healthcare. And the work continued to mature and grow and gain recognition through the community-based methodology that we had developed. Go to the next slide. Next one. Next one. Next one. So many of you know about Lake Junaluska, but probably not all of you, but it's an absolutely gorgeous place. It's Methodists like to say it's the closest place you can get to heaven on earth. And I was practicing surgery there, and then go back. And we ended up having a small office there right on the grounds of Lake Junaluska. And I continued to work on behalf of the organization about half-time, as it turned out. And then we continued to look for money through the Methodist Church and other sources. And go to the next slide. Another amazing thing happened. I've had a lot of difficulties and challenges and setbacks, but I've had some spectacular successes too. And one of them is the fact that this woman that you see here, Bonnie Jones, was the wife of Jameson Jones, who was the dean of Duke Divinity School from 1981 to 1983. He died at age 55 or so unexpectedly from a massive heart attack. And the day that he died, after that, Bonnie got this idea that maybe she could help us in our work in Bolivia. And so eventually she moved to Lake Junaluska and spent 10 years working with us as unpaid director of development. And she had all kinds of connections with the Methodist Church, which was really great for us. Her son, Greg Jones, is the former dean of our school here. So there are a lot of connections that grow out of all that. Next slide. So in 1995, I'd spent 10 years at Lake Junaluska supporting the work that we had developed in Bolivia. We had a strong organization, and I was ready to do something else. I didn't envision myself being a fundraiser and a publicist. I was a more practical, on the ground kind of guy, and I planned to spend my life working overseas, providing medical care. And so I wanted to go back overseas and work, and I left Andino Healthcare in good hands, and I went to Bangladesh. And I lived out there for 4 years, and then I moved to Haiti, where I met my beautiful wife right here. And then I worked with a small NGO called Future Generations. Go to the next slide. So I worked in a project that was trying to make a small contribution to the enormous maternal child health and family planning program problems of the people who live in slums. And Dhaka, Bangladesh is a massive city with massive numbers of slum populations. So that was like a totally new experience for me, but a very wonderful experience in many ways. And it reaffirmed the strong belief I had developed in community health and community-based primary health care and visitation of every home, which has been a central part of my career. Next slide. I had visited the Hospital Albert Schweitzer in 1979, and I had learned about the work of Warren and Gretchen Berggren, and that changed my life. And that became the lodestone, the banner by which I continued my thinking of what I wanted to do. And then it turned out that in 1999, I had the opportunity after my 4 years in Bangladesh to go back to Haiti and become the director of the Hospital Albert Schweitzer there. And I hope everybody's heard of Albert Schweitzer, but maybe some of you haven't. If you haven't, go check it out. But the Hospital Albert Schweitzer in Haiti has had a world-renowned contribution in many different respects. It's been there since 1956, and of course we know all the troubles of Haiti. But I had the privilege of serving as the director there, and in my office was a bust of Albert Schweitzer, and we put a little thing around his neck there that says, "I am the boss." So that was a great opportunity. We had many problems. It wasn't easy, but it was a great opportunity to continue my work to support the institution. But even though it's called the Hospital Albert Schweitzer, it has been a pioneer in community health work and primary health care as well. Next slide. After 4 years of that, I had the opportunity to join a small NGO called Future Generations that had a master's program. And I was on a missionary salary. I was the Carl Taylor Professor for Equity and Empowerment. And we worked with students from around the world who were interested in community development, and community health is one small part of that. And that was a wonderful experience too. The man who's has his back to you is Daniel Taylor, who was the son of Carl Taylor. And I'm going to tell you more about Carl Taylor in just a minute. I was the Carl Taylor Professor for Equity and Empowerment. Next slide. So when I got to be in my late 50s, I had this growing urge to become more of an academic. I never intended to do that. I was going to be a practitioner. But over the years, I realized I enjoyed the academic side of things, reading and writing, and to some degree research. But I also came to the realization that we needed more people working on the academic side of community health and primary health care. It was not an area that receives the kind of interest and support that it should have, given its importance. So I decided that I wanted to finish out my career working in academics. And one of the important reasons I did that was because I met a man named David Sanders at a global health conference who had been the founding dean of the School of Public Health at the University of Western Cape in Western Cape, South Africa. And I went up to him and I asked him a question after he'd given a talk. And I said, my name's Henry Perry. He said, Henry Perry, he said, are you the Henry Perry that wrote that article on the census-based impact-oriented approach? And of course, I was totally unknown to the world as far as I could tell. And then he said, that's a great article. I use that in my teaching all the time. And so all of a sudden, I mean, it took like a couple of years to get through this, but all of a sudden I started to realize maybe this stuff is important and maybe it will have some influence and maybe it's worth pursuing. And so after 4 years being a professor in this very small little NGO, I decided that I'd invite myself back to Johns Hopkins where I'd been a student. And so they somewhat reluctantly took me in. And I spent 10 years teaching in the Department of International Health there on community health and family plan, community health and primary health care. And I was trying to follow in Carl Taylor's footsteps. So I'll explain all that in just a second. Then in 2019, I was 72 years young and I was approaching a new stage of life. And I grew up in North Carolina and I had children here and I was ready to get back to my roots. And so we moved down here 5 years ago now. And I'm still working full-time as an academic pro bono, writing and being involved in a lot of different things. Next slide. So I've had the great privilege of many people in my life who have inspired me, and I'm going to mention just a couple right now who are sort of unsung heroes in my view. Next slide. So I've mentioned Carl Taylor several times. Carl Taylor, his parents were medical missionaries in North India, and they spent 50 years going from village to village, providing primary health care in the village during the daytime, and at night they told Bible stories. And Carl Taylor was 5 years old, and he started helping his parents do that. And he was a brilliant man. He became a medical missionary himself in North India, like his parents had been, but he got drawn into academics himself, and he became the founding chair of the first Department of International Health in the world at Johns Hopkins in 1967. And I went to Hopkins in 1970, 3 years later, wanting to be a medical missionary. And so we had that common bond of sorts, and he became my lifelong friend and mentor, and I became the Carl Taylor Professor for Equity Empowerment at the NGO that his son had started. So we had a long connection that was really, Carl became a world leader, a global leader in global health, and particularly in community health and primary health care, and died unfortunately in 2010. When he was a medical missionary in North India, he became friends with another medical missionary in North India named John Wyan, you see on the right. And John followed in Carl Taylor's footsteps doing community health research in North India, but then finished his career at Harvard. And he became a mentor to Warren and Gretchen Berggren, who I'm going to tell you about in just a second. But through the Berggrens, I met John Wyan, and he became my mentor until his death, and I spoke at his funeral. And he was the brains behind the community health work that my life's work is centered on. Next slide. So here you have Warren and Gretchen Berggren. And Gretchen Berggren, I think, may be on this. I called her right before, and she's 91, and I keep in touch with her. They were pioneering people who started out as medical missionaries in the Belgian Congo. And then they ended up becoming the founders of world-class pioneering community health work at the Hospital Albert Schweitzer in 1967. And I went there in 1979 and I saw their work, and that changed my life. They had published, Gretchen, are you there by any chance? I can't tell from here. Anyway, I'd like for her to wave to you if she could. But anyway, they had, one of the things that inspired me, go to the next slide. In 1980, I mentioned this earlier work where they reviewed the world's experience, and there were only 10 projects that had actually reduced under 5 mortality in the world. A year later, the Bergmans published their work in Haiti. They were able to demonstrate that through their community outreach program, they had been able to achieve an under 5 mortality. There was only 1/4 of that for the rest of Haiti. And that was the kind of work that I wanted to do and follow up on. And so eventually, my role as a surgeon seemed pretty irrelevant in a sense. And as time went by, I wanted to continue this kind of work and found it very difficult to be doing 2 different careers at the same time. So I decided to focus on this. Next slide. So I've been involved in writing and publications of various sorts. I mean, here are a couple of them. Next slide. This is the article that describes what I still consider to be a pioneering approach to global health work. It's never reached the mainstream, but there are various parts of it that are growing in importance, which involve, among other things, visiting every home on a regular basis and working in partnership with communities to address what their needs are. Next slide. As I said, I didn't intend to be an academic, but I've been surprised at how much influence my writings have had, and this is just one example. But this is an article that I wrote, and it's been cited by almost 1,000 other peer-reviewed journal articles now. It's sort of a standard piece about the importance of community health workers in today's world, not only in low-income countries, but in high-income countries too. Slide. I put together about 10 years ago something called a MOOC, a massive open online course, and Coursera is one of the companies that sponsors these, and so it's called Health for All Through Primary Healthcare, and 100,000 people have enrolled in this course, and it runs every month. I don't do anything with it; it just runs automatically. It's really been an amazing thing to watch. Next slide. And I'm writing a book right now with 40 other people on the history of Andean rural healthcare and Cure Americas, and it should have come out by now, but I've been delayed by other things I get drawn into, but it's going to come. And I'm also working on a high-level article that's we hope is going to be published in the Lancet about the cost effectiveness of investing in community health workers to improve population health. Next slide. So what started out as the Andean Rural Health Project at Duke became Andean Rural Healthcare. And then our work, I've told you about the things that I did, but when I came back from Haiti, I got back involved in supporting the work of Andean Rural Healthcare, but in an informal way. And so I've been doing that for 20 years. And the work spread to Guatemala, and then the name changed to Cure Americas. And then the work spread to Liberia, and the name changed to Cure Americas Global. And now we're developing additional work. And in the last month, we've changed the name again. I didn't change it, but the organization did. So it's now become Impact Global Health Alliance. And I've got a little video, if you can try that. Go to the next. Get that to work. I'm Henry Perry. I have been involved with this organization since it was an idea that began in 1969, which is at this point in time 55 years ago, hard to believe.
But over the course of this engagement, we've gone through a number of different name changes, and they've all been appropriate for the time. And when it was time to change, we changed it. And now we're at another moment of history where it's appropriate to think about a name change. And I'm excited about the next phase of work of this organization.
Changing our name to Impact Global Health Alliance reflects our ongoing commitment to delivering low-cost, high-impact maternal and child health programs. I personally love the word alliance. It highlights the strength we gain from working together, making us both better and stronger while prioritizing our shared vision. It represents our belief in the power of partnerships and invites others to join us. I'm confident this rebranding will propel us to new heights, and I'm excited to see how it shapes our future.
When I think of Impact Global Health Alliance, it reminds me of how we work together. And I'm excited that other organizations will now understand that by becoming part of Impact Global Health Alliance, they too can be a part of the way we interact together, we learn from each other, and together we create more impact.
People won't necessarily know what we're thinking of when we use the term impact and Impact Global Health Alliance, but the more they learn about us, the more they'll learn that we're into measuring the impact of our health programs and measuring improvements in health and particularly mortality. And that's going to be our cutting edge approach that'll carry us into the future. Empowering women, empowering communities. That's at the core of what we have done over the past 40 years. And we think that this new name reflects some of those values as well.
I'm proud to have been a part of this organization for over 10 years because I know that every dollar I donate, every hour I spend volunteering, the impact is amplified many times over.
What was formerly Cure Americas Global is now Impact Global Health Alliance. And I'm so excited about this because it brings a refreshing new vision of our future.
Impact Global Health Alliance.
Impact Global Health Alliance.
Impact Global Health Alliance.
Back to the PowerPoint. Next, go to the next slide. So when I graduated from high school, my father's medical partner gave me this book, Albert Schweitzer, and
This program is brought to you by Stanford University. Please visit us at stanford.edu.
Anyway, YouTube has these weird things, they jump all around without you being able to control it. But anyway, Albert Schweitzer was an inspiration for me in many different ways and continues to be. And that book sits right on my bookcase, right next to my desk now. So it's been a guiding force for me to think about him. And he himself is a great example of faith in learning and the application of that. He was, of course, a world-class theologian and philosopher and writer, as well as somebody who practiced medicine in East Africa for more than 50 years as a medical missionary. Anyway, next slide. So he wrote these words that continue to inspire me every time that I see them. And it, to me, speaks to me in the path that I have been through in the process of wanting to follow in the footsteps of someone like Albert Schweitzer, and also the life of Jesus as somebody who reached out and understood the suffering that people experience from medically related illnesses and who were dying from unnecessary causes. So we live in a world where we still have massive numbers of people dying from readily preventable or treatable conditions. And so I think that that's one of the great moral challenges of our world today, even though we don't talk about it as much as we should. But all of us should be concerned about the fact that we have so many people, most of them are mothers and children, but certainly not all of them, who are dying from conditions that we can very readily prevent or treat. And so I look forward, I hope, to a new era in which the world will take these issues much more seriously. Next slide. So I'm going to be talking again in January. I don't know exactly which date it is, but this was supposed to be a 2-week session, but it got messed up due to the technical problems last week. But one of the people I'm going to talk about when I give my second presentation, which is going to be about global health writ large, not about my personal story. But I'm going to talk about Peter Singer. Who knows who Peter Singer is? A couple of you do, but Peter Singer is a bioethicist, and he has a lot of important issues that he's feels strongly about. But one of them is that he says that all of us who live in the developed world, who are middle class or more, who have a comfortable lifestyle and have enough money to feed ourselves and to have education for our kids, et cetera, we should be giving 10% of our income to support programs that do the kind of work that we're doing. I've been involved in this for 40 years now, and fundraising has been an enormous challenge. It's just, there are a lot of good causes out there, but to find people and organizations who see the value of this has been a challenge. So I look forward to somehow the organization that I helped to start overcoming that, but I wasn't able to overcome it during my lifetime. I'm still working on it, but I'm kind of coming to the end. So anyway, I wanted to have time for questions and comments. So please, we've got a few minutes, 10 minutes.
Mike Runners, if you have a question, I'll have one.
It should be on.
My question is directly to you.
It's so that people online can hear you.
Oh. Okay. My question is that, like, I retired from the Air Force and I was in the medical field. But the thing with question I always wondered, like, when you go to these countries, have you ever had the opportunity to talk to the leaders of these countries? And the reason why I say that is that you see these leaders of these countries, and many of them are dictators and stuff, but the people are impoverished. And I wonder, do you think that you would have any influence if you had to talk to some of these leaders to, to say, hey, look, look what you're doing to your people? I don't.
Well, I never operated at that level, but there was someone who did operate at that level who was very effective, and through his personal influence led what is referred to as the first child survival revolution. His name was Jim Grant. His father had been a medical missionary in China. He was a brilliant man. He was executive director of UNICEF for 15 years, from the early 80s to the mid-90s. But he took it upon himself as director of UNICEF to go around the world and meet with heads of state, promoting two things. One was immunizations. The other was oral rehydration therapy for treatment of children with diarrhea. And he, through that influence, he did it. We need people like Jim Grant today. Paul Farmer, many of us know who Paul Farmer was. I mean, he certainly was very inspirational and had a big influence. We need more people like that in our world today. I'm not one of them, but we do need these people.
You mentioned the desire to raise money, and I wonder what's your goal? What would you want to feel fully funded, and how would the money be used?
Yeah. Thank you, Carl. That was a great question. We're trying to grow. We had the great privilege of having the United States Agency for International Development had a program called the Child Survival Program for US-based NGOs to work in child survival. And we got 8 or 9 of those grants that provided probably 70% of our funding for a long, long time. And that program ended about 10 years ago. And so since then, we haven't been able to find a grant source that could keep that going. And so we've had to shrink our work down to survive on donations from individual people and churches, small donations. But we also decided 10 years ago when this all happened, it created a big crisis in the organization, but the board decided it was time to build an endowment. And so for 10 years now, we've been working on that, and we have an endowment of $3 million now, which is generates $120,000 a year. Our budget right now is about $750,000 a year. So the goal was to get the endowment up to a level that could provide stable long-term support. And so we think that we have a methodology and a program that's worthy of emulation by other groups. We want to grow, but we want to grow in a steady, sustainable way. We want to continue to demonstrate through high quality science that what we're doing is effective. We have a lot of evidence to that effect right now. So we're trying to create a situation in which we can grow. We're starting to reach out to the Methodist Church in a number of different ways. So we've had a lot of linkages with them, but and we're also needing to, we've had such a long history with people who value what we have done, who also have access to people or resources. And we haven't really been able to capitalize on that as much as we need to and hope to in the future. We got 5 more minutes. I can talk for a long time, but be delighted to answer any questions that you have.
What's the antidote to the anti-vaxxers?
Yes, there was.
Well, bridging faith and learning. I'm a faith-driven person who believes in science and truth and facts. And so that's what our work is all about, trying to demonstrate with scientific evidence that what we're doing is improving the lives of people in a way that's sustainable and helpful. And who knows what's going to happen in our world? I mean, I'm not going to stand up here and try to argue with half the population of the United States that voted for Donald Trump, but I'm going to continue doing what I think is the right thing to do. And hopefully there'll be other people out there doing the same thing. I think there will be.
I would just say that topic that you just touched on would be a great topic for you to speak to in February or March. So please, since I have the mic, no, the larger faith, science, and how we can be informed to make a difference.
Sorry, I was just curious what the ongoing process looks like for these programs once you've established them in these communities. Like, do you have physicians who go back regularly, do update training with new medical techniques? I
didn't have time to get into all that, but we're very different from a lot of international organizations because we go and plan to stay and be involved for the long term. So the work that we started in Bolivia 40 years ago continues on through an organization that we helped to create in Bolivia. We send them very minimal amounts of money, but they're still going strong and they're part of our family. We've been working in Guatemala now for 20 years, since 2001, 23 years now. And that work more and more is being supported and sustained with local resources, either from the local government or from the Ministry of Health. We've been in Kenya now for 7 or 8 years, and that work increasingly is being supported by local resources in the government. And so we're planning to be there a long time, but we're also planning to phase out our financial support, but to continue with our technical support over time. And that creates lasting impact, we think, and that's the way to go. There's a lot of money that flows around in global health. A lot of it is for short-term projects, 4 or 5 years, that have massive amounts of money, then they stop. And then, of course, there's benefit from education. I understand that, but we're taking a different approach. It's a little bit like the old-time missionary approach. I mean, missionaries would go somewhere and spend their lives working there, and they develop churches and get involved in things that weren't short-term activities. And that's the the philosophy that's emerged from our work. Well, nobody has any other questions. So let me say that I really enjoy being in this class. There's a lot of interesting topics that come up and a lot of interesting people who come to this. And so even though we're a small group, it's something that I'm very honored to be a part of and very honored to be invited to speak to you today. So thank you.
Well, and we want to say thank you. Yes. Thank you so much for all that you shared. We're going to look forward to having you again in January. And next week, we have Will Willimon. I think we all know him, former Dean of Duke University Chapel, then Bishop. He's going to be here discussing with us the same-sex union decision at Duke Chapel Ministry to, with, and for LGBTQ Christians. So that's next week. Thank you.
Great. Thank you. Thank you. Thank you. Yeah, well, it's sure.